Hello, everyone. My name is Dr. Leibowitz. I am the Associate Medical Director at Mount Sinai Union Square in pediatrics. So I first want to say I'm very excited to be on this call and on this Zoom call. You know, the continuity of care is so important for general pediatrics. I mean, think about it. We see kids when they're born 8 times in 1 year, and that continuity extends also throughout their lives. And we pick up on so many things during that time. And what I think, especially with COVID-19, and I understand it because it was a scary time in the early part of March, a lot of families did not want to show up. And it wasn't just they didn't show up here in pediatrics, they didn't show up to school. So now you don't have teachers or coaches or other mentors that could have picked up on something that could have gone or is going wrong in a child's life. So even more reason for the children and the parents to bring their children to the pediatrician so that we make sure that there's no medical issues that is either needs addressing and that could be prevented, by picking up sooner. So let's think about it. How many kids come into our practice? Most of them are doing well, but a lot of them have some delays. And these delays come both in development delays, like speech delays or fine motor or motor delays. You know, a lot of these kids have either a chronic illness like asthma, and sometimes their treatment protocol is not working well. So the risk of not seeing us is both from the social delays, the mental delays, the physical delays, and also my concern is a lot of these kids have been home, and that social isolation has also caused a lot of these kids who may have underlying anxiety to manifest with more anxiety. And I think my biggest thing that I want to take out of it is that as adults, we have to teach kids as well in a balanced approach, and every family has to do it differently, how to navigate during stressful times. And a pandemic is a very stressful time for families. So how do we navigate that so that the kids know that, you know what, there's risks in life, but there's benefits as well. And the benefits of seeing your pediatrician, making sure that you get the right care, is so more important than the risks that we have in terms of contracting COVID. Well, I mean, I've always advised, even before a pandemic, anything that we can prevent. And that's what I loved about general pediatrics. We're there to prevent stuff, to empower the families that there's medicine available and vaccines available to prevent illnesses. And flu is one example. And my concern now is you have a lot of people who didn't want to take the flu shot before COVID was here. And now with both a pandemic and possibly a flu outbreak, you have a co-infection, and that could even overwhelm the hospital even more. So we have 16 medical conditions we can prevent. Let's keep the flu as one of them so that we can, prevent that as well. Because right now it's December 15th. We just started yesterday to get the COVID vaccine into, in New York. It's going to take some time for that to kick in. But now we have the flu vaccine. So make sure you get your flu vaccine as soon as possible. So we see children from the day they're discharged from the newborn nursery or the NICU. So they could be as young as 2 days old. And then we see them as old as 18, sometimes 19 if they have chronic illnesses, or a lot of our older patients, they don't want to see, they kind of like the general pediatrics. It's hard for them to just leave us. And we see most of our kids are healthy, but we have a lot of kids with complex medical history. And luckily for us, we have 3 pediatricians here. We speak English, some of us speak Spanish and Russian and Hebrew. And the cool thing is that we could do labs and vaccines, and we offer so many different specialists that they can come here in Union Square and see as well. So let's think about it. We're in Union Square. So Union Square has 7 different trains, multiple buses that come here. You come inside and it's a beautiful building. It's 5 floors of all the different medical care and services you can ask for. You have urgent care, you have radiology, you have a lab center. And when you get to pediatrics, you have a nice, beautiful waiting room, a nice aquarium, a friendly staff. We have books for all the kids. And one of the things that I think we stick out is we are trying to empower the kids as well as the families, to empower them to make the decisions that is best for their kids, and empower the kids to learn that they also have a voice. And I think that's what makes us unique. So I think the best thing is to just give you an example. So a few months ago, we had a mom and a child both test positive for COVID, and it was a newborn. And the coordination of care from the newborn nursery to telling the physicians, to the call center, to coordinating with the nurses when the mom can bring her child, to working with security. So at the time, this was all new to us, to make sure that the mom would be escorted into an elevator on her own, to creating a room for her, and doing it in a way with dignity requires a lot of team approaches. And I think for the mom, she felt not only that she was taken care of, but she wasn't like just an outcast that she had COVID and her child did. And remember, we're talking about March and April, where we're still very new to this illness. Okay. Another team approach I give you, we had a child that had some abnormal physical findings, some abnormal labs, and I was able to get them on a telemedicine the same day, get him to an imaging study 2 days later, and it was hospitalized and got the medical care that would have taken maybe 2 months to complete a diagnosis. So first of all, in Union Square, everyone in the building must wear a mask. So when you come into the building, there's a screening team that basically checks for your temperature, asks you questions about COVID exposure, and any patient or child that has fever or some illness that concerns them, they first make sure to call us in the practice to say, hey, this is a child or that has the following symptoms. Is it okay to send them up? So we get the heads up as well. On the way up to the elevator, it's limited to a few people per ride. There is Purell products everywhere around the building. In the waiting room, we have social distancing. And also what we do is we limit it so only one parent is allowed in the room. And I think the night team as well also cleans the entire rooms every night with a terminal cleaning. And I think with all these precautions, we're definitely taking all the necessary steps to keep children and their families, preventing from getting COVID. Well, yeah, yes, we do. We were kind of late in the game, but we definitely got started once the pandemic started, because a lot of families wanted to stay connected to us, and this was another option available. So yes, we do offer it. So let's think about it again. So you have an amazing location, you have a very friendly staff, the family can get entire care in one building. So that's both the parents, the children, if the grandparents bring them in as well. And on top of that, we have a peds-friendly atmosphere. And I think all those are such winning attributes to the location and for the staff. So the easiest thing is to call. It's 212-844-8300. I think I have the number here. So again, 212-844-8300. And you know what? People Google things. So if you Google Mount Sinai Union Square Pediatrics, you will find us as well. Some have the app MyChart and ZocDocs as well. These are all ways that they can reach us.